Thank you, Ronan. So that's a lovely video of what Ireland has to offer. Ireland is all about life, community, nature, and culture. So it's a fantastic country to have an experience, but we'll hear more about Ireland from our fellows as well and their experience. My name is Alejandro Lopez Valdez. I am an associate director here at GBHI in the Trinity site. I'm also part of the faculty as well. So I do engage very closely with the fellows during their experience here. And that is actually what I want to talk to you about today. So the experience of the fellowship in Trinity as a whole. Rachel, would you like to go next? So GBHI was founded in 2015 by a generous gift from the Atlantic Philanthropies. Now, specifically, a gift from Atlantic Philanthropies founder, Chuck Feeney, who you may or may not know about, but he amassed his wealth through the duty-free shopper group in the shops at the airports, particularly in Hong Kong and Asia Pacific. This fellowship was instituted as part of a program of Atlantic Philanthropies. So it's part of 7 different programs, or 8 if you count us, around equity. And there's social equity, there's health equity. We are brain health equity. The idea behind it was really to address the mission of raising awareness and reducing stigma worldwide around the concept of dementia. Now, 10 years have gone by, and as such, our thinking has evolved in a very prominent way. We don't look at brain health anymore as related only to neurodegenerative diseases or the absence of neurodegenerative diseases. We look at it as a life course process where we want to make sure that we engage early and we address risks to reduce the possibility of affecting our brain health. As such, the program then has the vision to create leaders in the world that can address the threats to brain health. And that is across the life course from early years to old age. We focus on the social determinants of health, brain health, and inequities. You would have heard about some of that, but the program in itself, we cover some of that aspect, and we understand what the social determinants really mean when we talk about brain health as a holistic process and a life course process. As I mentioned before, we are based in Trinity College in Dublin and at the University of San Francisco in California. So we run under the same mission and vision, but we have localized experiences because we target to the strengths of each of the sites that we have. Rachel, would you like to do the next? So the mission is to advance brain health worldwide, and we do this with 3 key pillars. The first one is training and conducting generation of leaders throughout the Atlantic Fellowship, and this really is crucial. You apply to a fellowship as an individual, but you become a community very early on the program with the cohort that you share that experience with, and also after the program at the community of fellows that you get inducted to, and we'll talk a little bit more about that in the presentation. Our second pillar is collaboration and expansion of prevention interventions. So we understand that there are more things shared across different cultures in terms of dementia and dementia advocacy and awareness, that we can share what has worked in different parts of the world. However, we understand that we can't just translate interventions or programs from one place to another without considering the cultural adaptation needed for each of those aspects. So this is the richness of having a global community that allows us to understand what works well and how do we go about it by adapting it for our own region and our own cultures to be effective. And the third pillar is in the sharing the knowledge and engaging in advocacy around brain health. We understand that this is a problem that is not going to go, it's not going to disappear. If anything, it's going to become more prominent. And we want to make sure that we are in the right spaces, talking to the right people, in the right tables to be able to amplify the message and generalize the findings that we have throughout the program. Rachel, would you go next? How does this look like? Well, what you're applying to or what you're intending to apply to is a 12-month in-person fellowship here at Trinity College Dublin. You can see my virtual background. That's exactly where Trinity is. That's exactly how it looks throughout the year. The fellows can concur. In the wintertime, it's a little bit darker. Throughout that 12-month period, you get involved in a interdisciplinary curriculum designed and developed around equity. And it's the informed understanding about brain health, dementia, and we draw from the clinical, scientific, and humanities expertise. One of the key aspects of the fellowship at Trinity is transdisciplinarity. And that really means that you are surrounded by an ecosystem of several disciplines. And we're not only looking at the brain health concept from the neuroscience approach or the clinical approach. We want to see it from a combination of disciplines, from arts, policy, advocacy, technology, science, and clinical expertise, right? We have clinical experience here in Trinity College. We offer career duration mentoring. What does this mean? This means that throughout the year that you're here, you are accompanied by part of the faculty, including people like myself, whose idea or whose role is to help you develop those leadership skills that you are intending to build. And it doesn't end once you finish the fellowship. This is a connection that remains with us throughout the rest of your career. There's also funding for pilot projects. So throughout the year, you process and you develop an idea that you are allowed to pitch at the end of the fellowship for a bursary to be able to advance your brain health career going forward after the fellowship. We have an international network of colleagues and collaborators to drive this common mission around advancing brain health. And finally, at the end of the fellowship, you do get a postgraduate certificate from Trinity College Dublin on brain health equity. Why do it in Trinity College Dublin? Well, we have a number of key aspects that are able to highlight. One is the country itself. So it's a very welcoming country. It's a very safe environment. Ireland is a country that welcomes with warmth and shares the diversity of cultures that it has at the moment. It's a small country, relatively speaking, in comparison to the majority of the world, but it does have a high quality of life. So the year that you spend here, it's an easy way to relax. Now, having said that, there is an onboarding process that you have to go through as well. So that always has its challenges everywhere. The program itself and life in Ireland is in English in the majority. And Trinity is one of the ancient universities of Europe. So we have a long tradition of academic and excellence in academia and research. Trinity College Dublin is the #1 university in Dublin, in Ireland, and it's ranked 83rd in the world. And we're surrounded by a culture of innovation and creativity and creative. There is lots of creativity around, lots of culture around in Ireland, from music, arts, literature, but also around technology. So you know that there's a big medical technology sector here, there's a pharmacological sector here, and also we're surrounded by a lot of the fintech industry as well, including giants like Microsoft, Meta, and Google that are just around the corner from Trinity. So these are just a few tips of why Ireland is the right place for you to embark in this experience. So we offer an innovative and a enticing environment for you to thrive. Would you go to the next slide, please? One of the things to consider about the fellowship is that it's a leadership fellowship. So what we mean about that is that the idea of you applying to this fellowship is not to do a postdoctoral stay, is not to do a research stay, is to really transform the way in which you think and the way in which you are currently engaging with your brain health journey, and be able to use this to potentiate your platform and be able to drive your ideas forward at the end of the fellowship. What we're looking here is for you to spend 12 months with us and develop set of ideas that you think will transform the way in which your region is dealing with brain health equity in particular. The experience in Trinity, it's really guided by principles around life course brain health, addressing inequities and social determinants across the life cycle, understanding how our environment, our social environment and climate environment shape the way in which our brain health trajectories are moving, but doing it from the perspective as well of the individuals. So we have a big emphasis on patient and public involvement. We have panels of people with lived experience, their carers, their partner organizations that are at the core of our discussions as well. We are fortunate to have a breadth of disciplines represented in our faculty, from psychology, medicine, nursing, engineering, creative arts, all with an international track record in research and teaching. But again, the emphasis is not to become one of us. The emphasis is to develop your leadership style to be an advocate for brain health back in your region where you are coming from. We have a rich collaboration ecosystem with our hospitals that Trinity is affiliated to, non-government organizations locally and globally, communities and cultural organizations that enrich that learning process. So you are able to taste a little bit of everything that we can offer in Trinity during those 12 months that you spend time with us. Rachel, next. Interdisciplinarity is at the core. And it's as soon as you walk through the door of the building, you're received, you're welcome to a foyer of different disciplines already. And the idea is to understand that there's not one lens through which we can see the problem. We can understand brain health through many different perspectives, and we can enrich solutions by considering and talking to people from different perspectives. So we draw with our expertise from arts, humanities, health economics, social sciences, neurosciences, and clinical sciences. And we expect everybody to partake and to receive and also chip in with their own perspective into the mix, because that is exactly what creates that transdisciplinarity effect. It's something that transforms and something that transcends the way you're thinking by understanding how other people see the problem and knowing which strengths you can leverage in order to create a much better solution than what you had originally envisaged. We do offer a diverse range of learning experiences, from flipped classroom sessions, clinical rotations, clinical lived experience going to the hospital, experiences with the School of Drama, design thinking workshops, so on and so forth. The idea to understand here is that brain health is a systems level problem, and we need to equip you with all the tools available to you to be able to tackle that system in different perspectives. There's leadership in arts for brain health as well, understanding that the arts have a crucial role in developing, maintaining, and enhancing brain health throughout the life course. And we have initiatives that have transcend the borders of Ireland, like Creative Brain Week, which you may have heard of. You may have participated in here in Trinity in every year, or you have seen one of the satellite events that have happened across the world in recent years. And we have everything here rooted in equity to advance life course brain health. Equity is an interesting concept as well. Equity differs from equality in that it's not about giving everybody the same or understanding that everybody is the same. It's about giving everybody the quality of tools required to achieve the same outcome. And that's exactly what we're trying to drive. Want to go next, Rachel, please? As I mentioned, one of the key components of the fellowship program is the mentorship. And the mentorship is this opportunity to have a one-to-one relationship with a faculty member that provides guidance and advice for professional collaboration and growth. It's an accompaniment of the year. And the idea, as I mentioned, is not to change the way in which you think and to mold it to how we think, is to help you understand your strengths, help you discover the leadership style that best suits you, and take that on with you so that you can become that leader that we expect you to become in the future. It's about potentiating yourself in the space of brain health. And that is a key aspect of the mentorship. Our role is to connect you with the best individuals that we can think that will open the opportunities for you to thrive, and also to be a soundboard of ideas for you to develop your own mindset and your own leadership style. We do that through innovative research that we have in our platforms. We're nested at in the Trinity College Institute of Neuroscience, which is a renowned research institute and houses a platform of research technologies from molecules to mind that would allow you to explore different aspects. And we have a collaborative and equitable approach. So you engage in shared inquiry and capacity building. While you apply on your own, if accepted, you're part of a community from the outset. And this is part of the transformation. I've said it before, and I always echo it, because it is that immersion in this group of individuals going through the same transformative process that makes the experience rich and that creates that opportunity of transformative growth. Rachel, next. The way in which the fellowship has been designed and the way in which we look at this is through a process of theory of change. And the idea is that we allow you to go from individual to leader that can change the world. And you do that through experiencing GBHI, build the knowledge and hone the skills and collaborate with your peers, receive the information that we can provide you, both from the brain health knowledge, but also the leadership skills, the grant writing skills, and communication skills, and allow you to expand that knowledge with every element that you can find useful to you from what we offer as the ecosystem in Trinity, allowing you to engage with the community, to start trying and to start probing the areas of interest that you have, so that you can then produce impactful through populations, practice, perceptions, policy, and publications. We guide you, we support you, and we accompany you through this process. But the transformation is yours. The transformation process is yours, and the impact that you have is, of course, your impact, which is what we are always delighted to see from the different cohorts that passed, or that have passed through the 10 years that GBHI has been in existence. Rachel, we've been around for 10 years. So we founded in 2015. Our first cohort was in 2016. And we have fellows now from around 66 countries in the world. You can see in this map where that distribution is. We have over 300 Atlantic fellows that are part of that community. And it really is essential to understand that the network is the net worth of the program. Having an army of allies around the world that have a similar mindset, a shared vision, a shared mission, and a keen and shared values, it's super important for developing projects and for creating impact worldwide. You're not alone, you're here with everybody. So it's a lifelong global community. You have personal and professional connections across different disciplines and borders. Very rarely we see people continuing in a specific silo. We can see the effect that it takes to be able to understand that people from different disciplines and people from different perspectives can amplify and can enrich a project. And this is the most important part. There's opportunities for cross-cohort collaboration, events, and ongoing mentorship. And it is as simple as sending a ping to the community and saying, I have an idea, I don't know how to start, who can help me? And it's very, very, very empowering. So with that said, I won't continue to kidnap the conversation around the fellowship. Instead, I would like to call on some of the fellows that we have. So we're joined today by 3 Atlantic fellows, 2 of whom have just completed their fellowship this year, and 1 who is an alumni of a couple of years ago. So we're joined by Kimberly Benjamin, Will Dean, and Anusha Mohan. So I'm going to introduce first Kimberly. She will be our first testimonial. Kimberly is an attorney at law who specializes in health and human rights law. She's a member of the Barbados Alzheimer's Association and has been engaged with projects on the rights of older adults since 2017. Kimberly has just graduated from the Atlantic Fellows program at Trinity College this year. Kimberly, can you turn on your camera and open your mic?
Hi, everyone. Thank you, Alejandro.
Thank you for joining us today, Kimberly. So why don't you tell us a little bit about your process to decide how to apply or why to apply to the fellowship?
Yeah, well, I'll start by saying I didn't know anyone at the Global Brain Health Institute, and I didn't know anyone who had done the fellowship. So really my motivation to join was exactly what was available on the website. So there's a wealth of information on the website there. And for me, it was a rare moment on LinkedIn that brought me to the application deadline just a few weeks before, I would say, the deadline. And having read everything that was available about GBHI, having watched the Chuck Feeney documentary, read the fellows' profiles, the projects that people were working on, I was intrigued. And so I decided, coming from a small island, Barbados, in the Caribbean, basically in the middle of nowhere, and having felt very isolated in my work, that I wanted to be more connected. I think as human beings, we all want to be part of a community. And oftentimes that's personally, but also that happens professionally. We want to be connected professionally. And that was certainly the case for me. And having read everything I could about GBHI and this lifelong fellowship, I felt like it was what I was looking for professionally. It was community. It seems like collaboration. It seemed like a very values-driven network that I wanted to be a part of, because when I looked at the values that were listed on the website, they aligned with my personal and professional values. So there was that key component for me. And so for me, it was that. It was community, it was collaboration, it was a network, but it was also a little piece on the website that talked about the mentorship that you mentioned earlier, Alejandro. And again, because from a small island, there are limitations in terms of who you can call on and who's available to assist you. So I felt as though I was lacking professional mentorship. And so when I saw that as a component of this fellowship, it really intrigued me. And then, of course, there's the funding part, the ability to apply for this pilot funding that was also attractive for me, because again, from a small island state, resources are limited, and I was looking for ways to amplify the work I was already doing on the ground. And so, yeah, it was basically that combination of things that led me to applying.
And having complete the program, what surprised you the most of the program? What did you think? I did not expect this.
Honestly, it's the ability of everyone within GBHI. So the faculty, the staff, even the security, that when you come through the door, to connect you to people who either share an interest with you in the work you're doing, or who can help you with something you're working on, or with getting a room that you're looking for on campus to hold an event. So it was really that was surprising, the ability of the folks at GBHI to make connections for you on the ground here. And it reminded me honestly of how we do life in the Caribbean, because we always say like someone knows someone who knows someone. And it's certainly the case here. But what's different is here in this community of the Global Brain Health Institute, people are willing to share those connections, and to not only share a name or email address with you, but to do that initial email introduction to ensure that, hey, this is someone I vouch for. And that goes a long way. And it has opened so many doors for me while here on this fellowship.
And lastly, maybe after the fellowship now, do you still feel that you're alone? How does that work now?
No, I feel very well connected, not only here in Ireland among my 2025 cohort. Shout out to the 2025 cohort, which has been amazing. But I also feel connected to fellows at the sister site in UCSF. I feel connected to the global community of fellows. So I'm going back home, not alone, with ongoing collaborations, with this sense of the community work and the work I was already doing in Barbados. I'm not on an island doing it alone. I have this global community now that I can call on for ideas. And I think quite importantly as well was my engagement with the people with lived experience while here in Ireland. So I was connected to them through GBHI and working with people living with dementia and their care partners. And that has, yeah, it's been an incredible experience. I'm taking that back with me for sure.
Thank you very much for that, Kimberly. We'll bring you back to the Q&A with the panel together. But I would like to now introduce Will Din. Will is an advocate and producer. He connects youth advocates and change makers and works to improve the way our world perceives and responds to dementia, specializing in digital marketing, storytelling, and entrepreneurship. Will has also just completed his fellowship as part of the 10th cohort at Trinity. Will, thank you for joining us today.
Thanks for having me, Andrew.
So how has the program influenced the way you think about your leadership role in the space of brain health?
So for me, I kind of came in with an alternative background. I didn't have an academic past. It was very much, I came in with lived experience as a son of a mum living with young onset dementia and had a kind of a desire to try and make a difference through advocacy and kind of storytelling. So yeah, I think what's changed here is I was very used to having a gut feeling and taking action largely alone or, with like minds, whereas this has taught me that leadership is a team sport, meaning we can all have our own directions, but actually leaning on other leaders with mentorship, with global perspective, that's really helped inform the way I think about trying to solve these same problems moving forward.
How do you think that now that opens collaborations with people in the space from different disciplines or from different mindsets from yours?
So I think, well, the kind of experience of the year has been, I was sort of surrounded by a room full of experts in all their disciplines, and what was encouraging was just everyone was equal and open to collaborate. And I think we all have the same passion to solve problems. So when people brought problems to the table, everyone pulled at their kind of discipline and attached it to the problem, and things became very different and often better and more global. So I think the beauty of the network and the kind of global network of fellows is that there will be someone who has a unique take or a unique perspective or knows someone to help make this problem you have develop or be more innovative or encourage you to make it happen.
Fantastic. Do you have any memorable experiences that you'd like to share with the audience, having the memory so fresh still?
Sure, yeah. So I'd say one of the most memorable experiences has been, I'd say, a kind of smaller group of us, maybe less academic, but we had a real desire to try and do stuff while we're here within the Irish community. And as our kind of resident artist, Angie from Singapore, she led a series of arts workshops with a local kind of school. And we kind of created artworks with them, and there was an exhibition that happened during Creative Brain Week. And these are kids who are from Dublin, who'd never been on Trinity campus, who had never necessarily had these discussions or learned about brain health. And it all came together as a result of a small group of 4 or 5 of us going, we really want to try and do something in the community. So that was a special moment.
And I don't want to put you on the spot too much, but how do you think you have impacted other fellows during your year?
I think I would say I've probably asked the most questions. So I joke and say I have a tendency to ask silly questions, and the great thing is that everyone is kind enough to be patient and help me try and understand. Because often I find with science, or even trying to translate it to younger audiences, is there's a lot of jargon, there's a lot of acronyms, so I'm very often asking, what does that mean? And what does that mean for the people that we're here trying to serve? So yeah, I think I've probably annoyed people with an awful lot of questions.
The questions are a process of learning, right? I mean, it goes back all the way down to Socratic thinking, which is fantastic. If you look back at when you tried or when you decided to apply to the fellowship, was this the right move for you? Do you think this was a valuable experience?
Definitely. So I think the reason around applying was I'd met a couple of people who had done it previously, this is when I was really hungry to just learn more about the science behind dementia and kind of, yeah, to try and communicate that to different audiences. And I just got the sense that they were all super passionate and they were all doers. They were change makers. There was I didn't meet one that wasn't in the middle of something exciting. So that was encouraging. But I think, yeah, there's, I suppose I'm a very different, I think about the problems in a very different way, but the problems are still the same. And the intention behind trying to change them is the same. But now there's this genuine network of people that I can call on, lean on. Like, as a result of being here, you work on a pilot, but then there's probably 7 projects that I'm working on as a result of just being in a room with this great group of people.
Fantastic. Will, thank you very much. I'll bring you back again for the Q&A. Thanks for that testimonial. Now I'd like to introduce Anusha Mohan. So Anusha is a neuroscientist and program manager for a national research program at Trinity College called Emerald Louis, aimed to improve diagnosis, management, and lived experience of people with Lewy body dementia. She's also a trained Indian classical dancer. And while her research looks into the intersection of sensory perception and cognition in different conditions like tinnitus or dementia, she practices communicating neuroscience topics through performing arts-based workshops with the aim to promote brain health literacy in the general public. She's a member of the 2022 Atlantic Fellows for Equity in Brain Health cohort. Anusha, welcome. Thank you for the testimonial today.
Thank you. Thank you for having me here, Alejandro, and welcome to everybody who's here online.
You, like me, have seen many cohorts pass by. Not only yours, but you saw some cohorts before your time, during your time, and after your time. What can you tell us about that experience?
I think, first of all, the application process has become significantly more competitive. I think it was, and the fellows who've come through have had significantly more experience. We've seen that the reach of the program has increased. We see new disciplines come in. So we had our first lawyer this year. But I think one thing that is very exciting amongst all of the cohorts is this thirst to come together as a group. Sometimes I think it still baffles me as to how people from different disciplines, people who speak different professional languages and who speak different languages, are all able to speak one language or at least understand each other by the end of the year. So I think that has been something that's very consistent across cohorts. But yes, I think the number of disciplines, where people come from, and at what level people come in have significantly changed in the last 5 years that I've seen.
Your profile is super interesting because you're a scientist, you're an engineer, you're an artist, and an advocate, and a community. So you're well-rounded in all aspects. But when you started the fellowship, do you think that it awakened one of these profiles that was dormant, perhaps? Or how do you think the fellowship opened up different areas of yourself?
Actually, the reason I didn't know about GBHI when I came to Trinity, I came to Trinity as a postdoc. I had a very conventional academic career. I started off in engineering, but I did a PhD and I was here to do a postdoc in the School of Psychology. And one of the things that I really wanted from the fellowship, and the reason I applied, is because I wanted people to see me as a dancer and as a neuroscientist. The dance part of me has always been there. I had kind of lost touch with it for a few years in between. But I think what the fellowship really gave me was, yes, that identity. I think when I came in as a postdoc, and when I left as a leader, and I left as somebody who is straddling the arts and science streams parallelly. But also, I think it takes a couple of years for the fellowship to really kick in the body, because what the job that I do right now is something that needs me to speak to clinicians, to advocates, to people with lived experience, to scientists like myself and engineers like yourself as well, Alejandro. So without the fellowship, I don't think I would have been able to do this job and be able to adapt to the needs of this job very quickly. And also, we have a very strong art stream. So it has really taught me to speak multiple languages, not speak multiple languages, but at least understand what I don't know in different streams. And that's what's really sort of, I think it's kind of brought me, it has awakened different parts of me, but at the same time, I think it integrates me in a way that is coherent to who I am cohesive to who I am as a person as well. So there's a lot of personal development there as well.
Yeah, that's amazing. And you mentioned your role as a leader now, and I want to maybe frame that as a leader in brain health, and you have a lot of engagement with people with lived experience and public and patient and public engagement. How did the fellowship prepare you for that?
I think what the fellowship gave me was, first of all, we are all humans, we are all people, and it is about respecting the other person across the table, first as a person and then as a professional. So that has been really key in connecting with the community, especially of people with lived experience. And it's really about it's actually, to me, at least in my experience, it was about shedding some of our identities and shedding some of the ego that comes along with the expertise that we have, and really just be vulnerable. We speak a lot about vulnerability in leadership. So it's really about being vulnerable and having the courage to say, I don't know, please tell me, and please help me as to what I need to learn in this space. So it's the curiosity, the vulnerability, and I think the internal joke, the A-Force joke, which I won't go into detail, and the people who apply and get it will know when they come into the fellowship. But but it's true that the 5 values or the 6 values that we have, and empathy is such a core element of it. Empathy, vulnerability, courage is such a core element of holding space for people with lived experience, but also that's something that comes from holding space for people with other perspectives in the same room.
Thank you, Nusha. Thank you very much. I see there's quite some questions about the application process and everything. They're going to be answered live, so we're going to go through that. What I would like now is to invite Kimberly and Will again to join us and see if anybody has any questions specific to their experience or to their testimonial, and we can address that live while the other questions are answered in the background. So if you have any questions to either Anusha, Will, or Kimberly, you can write them on the Q&A and we could address them here in the plenum.
Elizabeth here. How can I report some of the common questions that have come up and might be useful to a wider group? The first one is, would you recommend a candidate who is at the same time working on a PhD to apply for the fellowship?
Is it for one of us?
Yes, for one of you.
Oh, I would say no. No.
Indeed.
I think it's no. The PhD it's a very specific training. If somebody is doing a PhD, I'd say focus on the PhD because it's a very different set of skills that you develop in the 1 year, and the 3 or 4 years that a person is doing a PhD is extremely valuable and needs to be focused. So maybe following the PhD, and this is really a mid-career career development, professional development piece where I think some not just domain knowledge, but really world life experience is key to coming into this fellowship as well. So it could be that the person who's doing their PhD is, in their mid-career stage somewhere, but I'd say maybe a couple of years to settle into where they want to go, and then applying for the fellowship would be my advice.
Thank you very much for clarifying that. Very good. Another question that I want to pull from the list of the open question is, what do we mean by mentor? Kim or Will, who is a mentor for the applicants? Who can be a mentor for the applicants?
So I'd say for me, so we kind of get a sort of a single mentor as like from the beginning as your sort of person throughout the year. So for me, it's kind of a different discipline, but someone who's really helping me with leadership and really my kind of sounding board for all the ideas and all the projects. But then I think inherently that the faculty are all on the same floor as us with the office. So I think you get a lot of mentorship from whoever you'd like to speak to. I think there's a lot of people that I think that's what's unique is the access to faculty is amazing, but you always have one dedicated mentor throughout the year and kind of beyond as well. So it's been really helpful to me.
Thank you, Will.
If I could add to that one, to what Will said, in addition to the GBHI mentors, part of your pilot, there's also a regional mentor. So these are persons from your kind of geographical region or maybe a professional sphere, that region as well. So there's that. And I've also found mentorship organically, because of the connections and the collaborations that you're making in this space, which happen quite naturally. You will find mentors in so many different settings, sometimes from past fellows. So, I mean, I haven't called Anusha a mentor, but we've worked closely over the year and I've learned a lot from her. So there's, mentorship from past fellows, there mentorship from across fellows from other programs. So it's quite broad, I would say.
Thank you, Kim.
And I'm sorry, if I may add to that, I think we should also be thinking about peer mentorship. We learn a lot from each other, even in the group. GBHI is a big symbol for horizontal leadership. So there's always something that the other person brings to the table that you don't have. So there's a lot to be said about peer learning that happens and peer mentorship that happens. And really, peer mentorship is sometimes it looks like being a champion and being a cheerleader for somebody, and it could be as simple as that, to really learning a skill and learning some domain knowledge from somebody else.
Thank you, Anusha. Thank you, Kimberly. Thank you, Will. There's a couple of questions in the chat, maybe that if you guys can answer. Will, there's one specifically for you, but I'll let you answer that offline. On the interest of time, I would like to introduce Rachel O'Malley. So Rachel is a recruitment and events lead at GBHI and Trinity, and she supports the recruitment, engagement, and our outreach activities, helping connect diverse leaders from around the world with opportunities to advance brain health and reduce the impact of dementia. She'll really walk us now through the application process as such. So Rachel, the floor is yours. Thank you.
Thank you very much, Alejandro. So hello, everybody. I'm going to briefly walk you through the application process. I'm sure after hearing all of that information from Alejandro and the fellows that you were all ready to jump in and get your application started. So how do you go about doing this? So the application process has changed. If you have previously submitted an application, you'll notice that this year is slightly different. So in order to apply, you would still go through GBHI, and then you could go to .org/apply, or just follow the links through to apply through Trinity. When you get to the apply page, you'll notice that you can apply to GBHI at UCSF or Trinity. So if you're interested in the Trinity application, you would be going to that. And then when you're on the Trinity page, there will be a lot of information about Trinity and why to choose Trinity as your preference. And if you scroll down to the bottom of the page, you will see that there are 2 links there to apply to the fellowship. So this is a slight difference from previous years. So you'll notice that there are 2 different application portals on Trinity's website. So one is PhD holders and the other is all other applicants. They are the same job, and if you look at the job specs, they're the exact same programs. There is no difference. The only difference is that because we are going through Trinity's HR system, in order to be officially called a research fellow, you need to have a PhD, and so that is why that is kind of separated out. But they are the exact same programs, and it's just for HR, for clarity, that we have 2 different systems for people to apply to. But you are going to click whichever one is relevant to you. And then you'll be brought to Trinity's HR page, so it's through Core HR, and you will be given the job description details overall. And while you can't see it on this page right here, right down at the bottom, you'll see a link to apply, and that is how you would go through the application process. It does make you sign up to the core portal, so you'll have to give an email address and a password to log in, and that means that you can come in and out of the application process as you complete it all together. So you don't have to do it all in one go. You can come and go as you choose. You'll see at the end of the job description details there are 3 different downloads that I'll speak about in a minute. But just for your clarity, there are 7 steps in the process. So there's 7 different pages, and at any point you can save your application. You can skip ahead and fill in certain parts and then go back. And you just submit once at the end with a submit button, so you're free to kind of edit as you please. But the 7 different steps are your personal details. The second step, it would be uploading your CV or your resume, and then the statement of purpose, which I'll speak about in a moment. It then asks you for current or previous employment details, and you can put in as many previous employment details as you wish. It will then go to your qualification details and ask information about that. And then you can also upload, if you wish, your professional qualifications or memberships information. One change from previous years is that we no longer require 2 letters of support. So instead, we will just be asking you for contact information for 2 professional references. And then at the end, there is also an opportunity to fill out an equal opportunities monitoring section. And this is an optional section that is not shared with the reviewers. It is just for HR purposes. So you will have the option to download 3 different forms. The first is the job description with all of the information about the job post, about how to apply, about what we're looking for, and also the different parts of the fellowship. And then there is also a statement of purpose. So this is a downloadable PDF that you download, and you can edit it in as you wish. And then you'll be asked to upload the statement of purpose along with your CV or resume during the application process. The third download is just information for applicants, and so it's just standard information like communications. There's also a piece on Garda vetting, pensions, and more information about being a Trinity employee. So once you have all these things together, you might be asking about your statement of purpose. So this is the PDF that we ask you to fill in and then upload. It has 5 questions on it that we are looking for to kind of gauge your suitability for the role. So the 5 questions are, and we ask that each question is answered with no more than 150 words, so about 75 to 150 words per question. The first question is describe your professional interest in the area of brain health, so your motivation for working in this area and your goals for the future. The second question is to describe your experience working on issues related to brain health equity and how you have shown leadership. So giving an example of a specific equity related problem that you have addressed. The third question is what excites you about joining a lifelong fellowship and the community of brain health leaders, and in what way would you contribute to this community? And then the fourth question would be to identify relevant individuals, organizations, or institutions in your home region or in the communities your work serves that will help you achieve your objectives post-fellowship. So describing why they are important and how you have already engaged in them or plan to engage with them in the future. And then finally, it's just to describe an ambitious yet attainable set of goals you aim to accomplish within the first 5 years of completing your fellowship. So ideally, these goals should focus on making a meaningful impact in an undisturbed community. And so, as I said, 75 to 150 words per response. So once you have your CV and statement of purpose done and you are submitting everything, we just recommend that you make sure that you leave enough time and that you get your submission in before the closing date. So the closing date is September 18th at 12 p.m. Irish time. Just for your awareness, it is a Trinity portal, and so it just immediately will discard any unfinished applications at 12 p.m. and you won't be able to get back in and complete it. So make sure you leave plenty of time and submit it before it closes down. So you, as I said, you can save your progress and you can go back in as you please to submit information. Your applications must be in English. And I've already touched on that it closes at 12 p.m. Irish time on the 18th of September. And just a final note to say that we do have a partnership with the French Alzheimer's Foundation. They separately fund a participant to take place in the fellowship, and that application you can apply through another application button that just will note that it is through the French Foundation Alzheimer's. And in order to do that, there are specific eligibility requirements because it is associated with their funding. So the selection criteria and process, so just for your knowledge, your personal mission needs to be aligned with GBHI goals, including a demonstrated commitment to brain health. You need to have visionary, ambitious ideas and a feasible plan to put them in action, poised to make an impact in your community and have potential for transformative leadership. You need to have a spirit of collaboration and interested in being part of a global network, and also then your specific plans for the next 5 years post-fellowship. Just so you guys are aware, the applications close in mid-September, and then we will be reviewing those applications through September and October, and everyone will be notified or invited to interview it towards the end of October. Interviews will be taking place online in November, and then we hope to have issued all further information or offers in December with all that information if you've been invited to join the fellowship. And at this point, it is just the key takeaways. So just to remind you guys to start early, get those applications in, make sure you detail your purpose and showcase your project, emphasize your commitment to the GBHI program, highlighting your experience, and of course, just remember that the application deadline is the September 18th. And thank you very much. I'll pass you back over to Alejandro.
Rachel, thank you very much for walking us through the application process. I think it's important to highlight, really think about how this fellowship can transform the way you already think, the way you're already doing and engage with brain health to potentiate your leadership role going forward. GBHI, we're going through our 10th year anniversary. There is a plethora of information in the website about the type of projects that have been successful, the impact that we have had, information about not only the Atlantic Fellowship in Brain Health and Equity, but about the Atlantic Fellowship in general and what it's like to be part of that Atlantic Fellowship community. So make sure you read up about this, make sure that you align your values, you align your mindset with that is expected of you in order to develop that application in a nice and cohesive way. At the very end of the day, this is about getting the right people in the right space so that wonderful things can happen. It's a transformation process that needs to happen. So read up, do your homework, looking at the different profiles and projects that have happened through GBHI. Look at Atlantic philanthropies and the Atlantic Fellowship programs so that you can align yourself in your application to stand out. I would also like to thank you all for attending today's information webinar. I do hope that you found it informative and that you have cleared some doubts that you may have and made up your mind whether you want to apply for the program this year or not. I'd like to thank our testimonials, Kimberly, Anusha, Will. Thank you so much for sharing your experience with us. Remember that you can also visit the website, gbhi.org/apply for more information and how to apply. And if you'd like to learn more about the Atlantic Fellowship Program at the University of California in San Francisco, which is a hybrid fellowship that's been run this year, there's an information webinar that will take place on Tuesday, August 11th from 4 to 5 p.m. UTC +1 time. So if you have any questions that haven't been answered, please contact us. So you can send an email to gbhiapply@tcd.ie for the application process in Trinity, or gbhiapply@ucsf.edu for the application process at UCSF. I hope that you enjoyed the webinar. I hope you found it informative. And thank you again for joining in. I'm going to give just a few more minutes on the Q&A so that the outstanding questions can be answered. But feel free to reach out if there are more things that we want to clarify for you. My name was Alejandro Lopez, and it was a pleasure to walk you through this webinar today. Thank you all so very much. Have a great rest of your day.